Okay, this next video is going to go over cranial nerve assessment. All right. As a clinician, it's important for you to understand the cranial nerve functions. All right. If you think about it, they're the peripheral nerves that are all up in the head. Okay, and they all have specific functions, just like the axillary nerve does. Okay, musculocutaneous nerve. Cranial nerve assessment would occur if you have some type of unconscious individual that becomes conscious. Okay, and you're doing an on-the-field eval. All right, but if someone walks into your athletic training room, as you'll see after we go through this assessment, if they're talking to you, all, if not most, of their cranial nerves have been assessed. So let's go through the cranial nerves. The first nerve is the olfactory nerve. Okay, the olfactory nerve is a nerve that, for assessment, you might need to have something, because it's to assess the olfactory nerve, you need to assess their sense of smell. So maybe some type of smelling salt, or if you don't have smelling salt, anything you have in the room that has some type of smell, you would just say, can you smell this? Okay. Cranial nerve 2 is the ocular motor nerve. Okay. Ocular motor nerve is a sensory nerve, and to assess the ocular motor nerve, you would say, can you see me? Or, how many fingers do I have up? Good. So now I know her ocular motor nerve is intact. Okay. The cranial nerve 3 is the optic nerve. And the optic nerve is both is a motor nerve, and to assess the optic nerve, you would assess pupillary reflex. Okay, so you would shine a light in her eye, her pupil would constrict. I take the light away, her pupil dilates. I know the optic nerve is intact. Cranial nerve 4 is the trochlear nerve. It's a motor nerve, and the ability to assess it is looking at the eye's ability to track upwards. So if I go up, I know her trochlear nerve is intact. Okay. Cranial nerve 5 is the trigeminal nerve. Trigeminal has two functions, a motor and sensory function. Okay? The way I think of trigeminal, trident gum, clench your teeth. That's the motor function of the trigeminal nerve. Okay? Sensory function is you want to make sure that they can feel when you touch their face. Okay? Cranial nerve 6 is abducens. The abducens, the way to assess for the abducens cranial nerve is to assess eye tracking side to side. So the abducens nerve is intact. Cranial nerve 7 is facial. Okay? Cranial nerve 7 has both a motor and sensory function. The motor function for the facial nerve is having her do any of the muscles of mastation, so which means smiling. So smile, so that's intact. And then also for sensory would be taste. Okay, so if you give them something to taste. Cranial nerve 8 is auditory vestibular cochlear nerve. Okay, the auditory vestibular cochlear nerve has two things. First one is hearing. So can you hear that? And I can't snap my fingers with my left hand. All right, so it's less. And then for hearing is auditory. And then if you think vestibular cochlear, that's balance. So balance, you would just have them stand up. Arms at your sides, head back, and you're doing a Romberg, which we'll talk about. Okay? So that's auditory vestibular cochlear, cranial nerve 8. Cranial nerve 9 is glossopharyngeal. To assess glossopharyngeal, which is a sensory nerve, you would just have them swallow. Okay? Cranial nerve 10 is vagus nerve. All right? It has a sensory component, which is speaking, so you'd have them speak, so say hello.
Hello.
Okay? And you can also assess the gag reflex. So you stick a tongue depressor in, okay, and initiate the gag reflex. Okay, so cranial nerve 11 is the spinal accessory nerve. Right? So the spinal accessory nerve, as we talked about, all the cranial nerves are very similar to the peripheral nerves that innervate down throughout the body, but they're peripheral nerves up in the head. All right? So if you remember, the axillary nerve innervates the deltoid. So to assess that, we do a shoulder abduction. The spinal accessory nerve, if you remember from surface anatomy class, innervates your trapezius muscle. So to assess the spinal accessory nerve, so cranial nerve 11, you'd have them do a shoulder shrug, hold it up there, let them pull you down. Okay. Spinal accessory. And finally, cranial nerve 12, hypoglossal. For sensory component, motor component, stick the tongue out, and then her hypoglossal nerve is intact. So those are all the cranial nerves. So let's go through them again so you can see how quickly they can be assessed as you talk to a patient. Okay? So hi, how you doing today?
Good.
Good. Okay, so good. So she just talked to me, she looked at me, okay, so she can see me, All right, so ocular motor is intact. Okay, pupils are intact if she's looking at me. Trigeminal is intact because for her to speak, she has to move her teeth. Trochlear is intact because I saw her eyes move up. Abducens are intact because I saw her eyes move side to side. Facial is intact because she had to move her face to talk. Audiovestibular cochlear, hearing, was intact because she responded. I would still have to check balance. Glossopharyngeal is intact for her to talk. She has to breathe and she has to swallow. Vagus is intact because she spoke. I would still have to assess spinal accessory. And then hypoglossal is intact because she had to move her tongue in order to talk. Okay. So again, those are the cranial nerves. You'll have to know them by ocular motor is assessed this way, but you'll also have to know what is cranial nerve 4 and how to assess it. So you'll have to know them both ways.